All right. So after reading chapter 2 of Epidemic, where it's COVID-19, how it spread, whom it affects most, and how it causes disease. So, this this chapter I kind of found just like very interesting. Um, so like when I started my undergrad for public health, I actually started it around the time that COVID-19 hit. So, of course, all of my courses were kind of like, oh, it's COVID-19, like this is a really big deal. We don't really know anything about it. So I was reading, it was like the first paragraph, right before it talks about like a brief history of COVID-19. It says right here, so the COVID-19 pandemic was unusual in sparring children, as many other infectious diseases have significantly effect on both the young, very young, and the very old. So it also talked about the polio. So polio most adversely affects children under 5 years of age. Respiratory, so RSV, which was very active in the winter of 2022, affects the very young and elderly. So then we also had like the influenza affects the very young and elderly most severely, although then the 1918 influenza pandemic was unusual in targeting healthy young adults. So that we knew very early on in the COVID-19 pandemic that it was a novel coronavirus, mostly spread to young children. So I think something that stood out to me was like the epidemiology of COVID-19. Now, epidemiology isn't like a huge topic that I like to talk about a lot. But I did find this specific thing very interesting. Actually, a couple things. So it says cases have occurred in every country. By November of 2022, 6.6 million deaths from COVID-19 have been recorded, though the figure likely underreports the true number. Moreover, there has been as many as 12 million excess deaths, that is, 12 million more deaths than would have been expected under normal conditions as a result of medical problems not cared for adequately during the pandemic. That includes the cardiovascular disease, cancer, strokes, and other infectious diseases, as well as from other indirect consequences of the pandemic. So I thought that was really cool. It's not really cool, but it was very interesting, and it's something that stood out to me. Another thing that I found along in the epidemic, or like the epidemiology portion of it, it talks about essentially like high death rates and who exactly it affected. So it says right here, another reason for high death rates early on in the United States may have been the failure to protect nursing home residents at that time, given that this infection is most severe for older individuals. An additional early contributor was the failure to protect racial and ethnic minorities from COVID-19, with Black, Latino, and Native American individuals accounting for disproportionately high numbers of infections and deaths from early 2020 through June 2022, due to an increase in vaccination rates in minority communities thereafter. COVID-19 deaths among white Americans surpassed those in other groups by mid-2022. And I think after reading that, I think it kind of just like clicked. I think something that was like very interesting about that was the fact that mainly people who were white were against getting vaccinations. So I think that specific thing kind of is just like it surprised me a little bit. And then it kind of just like clicked in my head, I guess. A particular quote that like stood out to me was under the section that says face masks for children. So it says right here, by the fall of 2022, after a prominent infectious disease journal published a reanalysis of CDC data showing that masking school children actually offered no benefit, an accompanying editorial by a prominent scientist in COVID-19 mitigation said that masking children for COVID-19 should be permanently discontinued. Other UK-based pediatricians concerned about the potential for harms of masks in developing children wrote papers along the same lines that fall. So I think that specifically was kind of interesting. And a quote that like really impacted me the most was, yet it was unclear what these proclamations meant because COVID-19 is a non-eradicable virus. COVID-19 will never be over, but it was clear that given the impact of COVID-19 response on other public health goals, we had to move on from the emergency phase of management. What we needed was a plan to manage the endemic virus. So I think something like that kind of is like really impactful, and I don't really have any questions about after this chapter.